Dear second year students, welcome in lecture 3 of medical parasitology. Today we'll talk about the second group of protozoa, which called the flagellates. The flagellates are the group of the protozoa distinguished by having one to several thread-like extensions from the ectoplasm in their trophozoite stage. The flagellate protozoa that parasitize man are conveniently discussed as A. The flagellates of the digestive tract and genital organs. B. The flagellates of the blood and tissues, which also called hemoflagellates. The first group of flagellates inhabiting the mouth, intestine, and genital tract and are typically lumen parasites. Although no member of the group is a tissue invader, giardial amblia in the duodenum and trichomonas vaginalis in the vagina may produce symptoms. Now we'll start with the flagellates of the digestive tract and genital organs. The first example is giardial amblia. This parasite has a cosmopolitan distribution and it's common in both warm and temperate climates. It causes a disease called giardiasis. Infection in children is more frequent than in older people. The parasite appears into two stages, trophozoite and cyst. The trophozoite lives on the epithelial brush border of the upper two-thirds of the small intestine, stick itself on the epithelial cells. It lives in the duodenum and sometimes entering the bile duct. When the trophozoite is seen from the ventral aspect or view, it appears rounded interiorly and tapering to a point posteriorly. Interiorly معناها من الأمام. Posteriorly معناها من الخلف. When viewed from the lateral profile, it has seen relatively thin and concave in the anterior half ventrally يعني من الناحية البطنية, forming an adhesive sucking disc. It bears 4 pairs of flagella extends along the midline. It has 2 ovoid nuclei, each with a central caryosome, and there is 2 exostyle between the 2 nuclei, extends to the posterior end. Here we can see a collection of pictures to the trophozoite stage. To the upper side, upper left, you can see the 2 nuclei, very clear, and the exostyle, and only a pair of flagella can be recognized in this picture. The second one, also a good and clear picture to the trophozoite. The third one, the upper right picture, treated with a drop of iodine, unstained. The lower pictures, the one to the left, stained, and we can recognize all the parts of the trophozoite, and to the right you can see the trophozoite hidden within the debris of the stool sample. The cyst stage is ovoid in shape with thick wall, and it has 4 nuclei found in one pool of the cysts or distributed as 2 nuclei in each pool. الأنوية الأربعة اللي موجودة بالسيست يا إما نلقيها في جانب واحد يا إما موزعة 2 في كل جانب أو في كل قطب من أقطاب الكيس. The cyst has also retracted flagella which appears as stiffly curved fibrils situated in parallel pairs. Look at the pictures below. Here is the typical cyst stage of giardial amblia. The right picture is treated with a drop of iodine, while the 2 pictures to the left stained with trichome stain. Here is another 2 pictures. The left one treated with iodine, and the right one magnified picture يعني مكبرة, and it's stained. Now we'll talk about the life cycle of giardial amblia. The human infection occurs by the ingestion of cysts in contaminated water, food, or by the fecal-oral route, which mean the hands or fomites. Desistation or excistation, عملية الخروج من الكيس, occurs in the small intestine, especially in the duodenum, releasing the trophozoites, where each cyst produces 2 trophozoites. The trophozoites multiply by longitudinal binary fission, colonize the upper small intestine, where they may swim freely or attach to the submucosal epithelium via the ventral suction disc. هذا الطفيلي يحتل منطقة بداية الأمعاء، منطقة الدودينم الاثنى عشري، ويكون مستعمراته colonize there. لهالسبب بقسم من المصادر نلقي أسماء مرادفة للطفيلي اسمه جارديا انتستيناليس أو جارديا ديوديناليس، هو نفس الطفيلي الجارديا لامبليا. The free trophozoites insist as they move downstream and mitosis takes place during the encystment. يعني عملية التكيس راح تحدث أثناء مرور الطفيلي باتجاه نهاية الأمعاء، وهو رايح باتجاه المستقيم يبدي يتكيس، وأثناء التكيس راح ينقسم ويكون الكيس الناضج. Cysts are resistant form and are responsible for the transmission of giardiasis. يعني cyst هو الانفكتيف stage مالها. Encystation occurs as the parasite transit toward the colon. The cysts are hardy and can survive several months in cold water. تشوفون هو طور مقاوم ويقاوم حتى المياه الباردة، درجات الحرارة المنخفضة في الماء. Both cysts and trophozoites can be found in the feces. The cyst is the stage found most commonly in non-diarrheal feces. لما نفحص ستول سامبل للبيشنت غالبا نلقي السيست ستيج، وخصوصا لما يكون الخروج مو ووتري non-diarrheal. أما في حالة الووتري لكونه إسهال شديد دي يصير، فممكن نلقي أيضا التروفوزويت مع السيست. The presence of up to several billion trophozoites in a single diuretic stool sample is not unusual. أحيانا ممكن نلقي several billions of trophozoites بعينة الخروج. لعد تشوفوا هو إيش قد أعداد الطفيلي اللي صابت البيشنت أصلا الموجودة بأمعائه، إذا بس بالخروج يطلع أنها القد عدد كبير. Man is the primary host, although beavers, pigs and monkeys are also infected and serve as reservoirs. يعني reservoir host مضائف خازنة، بس بشكل رئيسي الإنسان هو المضيف الأساسي لهذا الطفيلي. Because the cysts are infectious when passed in the stool or shortly afterwards, person-to-person transmission is possible. Ingestion of 100 or more cysts is considered infective. يعني هذا مثل الإنوكولم أو الدوز of infection. من 100 cyst وفوق راح يسبب إصابة، راح يحث إصابة واضحة تبدي تبين أعراضها علينا. Pathology. Since giardia are not been known to produce toxins، يعني الطفيلي المعروف عنه أنه ما ينتج توكسينات، ما ينتج سموم. It appears that symptoms result from combined mechanical and chemical factors. إذن الأعراض الناتجة هنا يبدو أنها ناتجة عن التأثيرات الكيميائية والميكانيكية الناتجة عن الإصابة بالطفيلي اللي هسه راح نجي نشوفها شنو. The infection is common in children 6 to 10 years of age, but is also seen often in older children and adults. يعني الأطفال أكثر عرضة للإصابة، مو معناها الأدلتس ما ينصابون، بس الأطفال نتيجة طريقة حياتهم البسيطة وعدم إدراكهم للمخاطر الصحية ينصابون أكثر، خصوصا الأطفال بالأعمار الصغيرة. الأكل من يوقع بالقاع يشيلوه ويأكلوه بلا ما يغسلوه، ما يتجنبون الأشياء الملوثة، ما عندهم وعي وإدراك كفاية. Outbreaks are frequent in daycare nurseries and other institutions where sanitation may be inadequate. The presence of the parasite on the surface of the epithelial cells on the brush border causes mechanical complication leads to malabsorption of nutrients and digested food because it forms a pavement-like sheet covering and damaging the mucosa. In addition, it causes an inability of the small intestine to absorb such essential fat-soluble substances and vitamins such as carotene, vitamin B12, and folate. These absorptive abnormalities may be accompanied by reduced secretion of a number of small intestinal digestive enzymes such as disaccharides. هنا الدايسكرايدز راح تتراكم بهاي الحالة بالأمعاء، ووجودها لفترة طويلة بدون امتصاص وبدون استفادة منها راح يؤدي إلى تخمرها وتعفنها، فراح تنتج غازات بسبب هذا الفرمنتيشن. mainly راح يكون السي او 2 واحد من عندها، راح يسبب انتفاخ البطن وأعراض أخرى هسه نجي ناخذها بعدين. The parasite also causes heavy mucus secretion and feed on this mucus the amino acids and the other substances passes through the intestine which lead to malnutrition and vitamin deficiency. كرد فعل مناعي لوجود الطفيلي واحتكاكه بالبطانة المخاطية، الجسم راح يفرز كميات كبيرة من الميوكس. هذا الميوكس عبارة عن بروتين. الطفيلي النوبة راح يستفيد منه، بدل أن ينزلق راح يستفيد منه ويتغذى عليه وعلى الأحماض الأمينية اللي يتكون منها، بالإضافة إلى غذاء على بعض المواد الأخرى المهمة المحيطة به مثل الفيتامينز والأمينو أسيدز. راح يسبب سوء تغذية ونقص بالفيتامينات. In addition, attachment of the trophozoite to the mucosal surface causes shortening of the villi. لكونه راح يكون موجود بأعداد كبيرة ويغطي سطح الامتصاص أو سطح الأمعاء، الجزء اللي بالامتصاص، فراح يسبب قصر أو صغر المساحة المعرضة للامتصاص، وأيضا راح يتسبب بعسر الامتصاص وقلة الاستفادة من المواد المهضومة. It will cause shortening of the villi of the small intestine, inflammation of the crypts and lamina propria, lesions on the mucosal cells, and occasionally the trophozoites penetrate the mucosa, but this is rare. هذا الطفيلي رغم كل الأعراض والإمراضية اللي يسببها بس مو مثل البلانتيديوم كولاي ولا مثل انتميبا هيستولاتيكا، ما راح يخترق الجدار، ما راح يثقب جدار الأمعاء ويدخل به إلا نادرا لما يكون هو أصلا أكو تقرح أو فشي، فهو مجرد أنه راح يختل بس مو هو اللي راح يهضم بطانة الأمعاء ويفلشها ويدخل بيها. Occasionally, bile duct and gallbladder involvement may produce jaundice and colic. These symptoms may become evident as early as 3 to 25 days, the average 10 days after ingestion of cysts. Now we'll talk about the immune response. Giardia is an extracellular parasite. يعيش خارج خلايانا. Extracellular parasite of the small intestine. Giardia trophozoites display surface antigenic variation mediated by a unique family of cysteine-rich proteins, variant-specific surface proteins VSP الرمز مالتها. المقصود بهذا أنه الطفيلي عنده أنتيجينات على السطح مالته هي اللي ممكن تثير الجهاز المناعي مالتنا. هذه الأنتيجينز غنية بالحامض الأميني السيستين rich proteins، لأن هو عبارة عن بروتين الأنتيجين. While specifics of the immune defense are not well understood, both humoral and cellular mechanisms appear to be important for parasite clearance. The infection apparently controlled by the IgA الجسم المضاد الإفرازي and IgM secretions of the host. However, there is evidence that depletion of CD4 plus T cells، هذا نوع من خلايا T helper cells، results in a marked decrease in the clearance of the motile trophozoites. هذا دليل أنه CD4 تشترك في عملية الكليرنس يعني عملية قتله والإراديكيشن مالته للطفيلي. Human infection result in the production of anti-giardial antibodies from mucosal secretions and serum, and IgA dependent host defense are central for eradicating giardia trophozoites. IgA is believed to bind to the surface of the trophozoite, inhibiting attachment to the intestinal epithelium instead of direct killing. يعني الدور الرئيسي للاي جي اي راح يكون انه يتصل مع التروفوزويت مالت الجارديا، وبالتالي يمنع ارتباطها او التصاقها بالميوكوسا مالت السمول انتستين اكثر مما يقوم بقتلها. راح يمنع التصاقها، تبقى باللومن، وبالتالي راح تنجرف والامراضيه راح تكون نوعا ما اقل. In an immunocompromised patient، يعني المرضى اللي جهازهم المناعي منخفض بسبب انه هم يستعملون ادويه تسوي سبريشن للجهاز المناعي، او عند مرضى الايدز وغيرهم من المرضى اللي عندهم انخفاض بكفاءة جهازهم المناعي. The prolongation and recrudescence of giardiasis is evident. هنا المرض ممكن أن يرجع مرة ثانية، ممكن أن يبقى الفترة طويلة من غير شفاء، لأن أصلا جهازهم المناعي مفعل. And the levels of IgG, IgM and IgA antibodies are depressed. مستويات هذه الثلاث أنتيجينات راح يكون أقل. Symptomatology يعني الأعراض. 1. Early symptoms يعني في بداية الإصابة، أول ما يبدي هجوم الطفيلي وتبدي الأعراض. Epigastric pain, abdominal cramps and discomfort expressed as flatulence، انتفاخ أو تسطح بالبطن. Abdominal destination, nausea and foul smelling, bulky, explosive and often watery diarrhea، إسهال مائي مع رائحة كريهة بالإضافة إلى تسطح وتوسع البطن، تنتفخ بالغازات اللي قبل شوية حكيت عنها. The stool contains excessive lipids but very rarely any blood or necrotic tissue. 2. The large quantity of mucus and the presence of fats with the stool leads to continuous diarrhea with a large quantity of mucus. The aggregation of fats results from the malabsorption of it. Sometimes constipation or steatorrhea الإسهال الدهني also may occur. 3. Weight loss. أكيد لما احنا لا دا نستفيد من المواد المهضومة، لا دا يصير امتصاص باستمرار اكو اسهال، اكيد راح يصير نقص بالوزن. The more chronic stage of infection is associated with vitamin B12 malabsorption, disaccharides deficiency and lactose intolerance, fat soluble vitamin deficiency. Here is a scheme for the life cycle of giardial amblia. You can follow this scheme. The diagnosis of the parasite is based on the detection of the typical cyst and less frequently the trophozoite in the stool. Trophozoites must be distinguished from the non-pathogenic flagellate Trichomonas hominis, which is an asymmetrical flagellate with an undulating membrane. طبعا هو الجارديا ما يخطئ، حجمه تقريبا أكبر من البقية، الشكل الأنوية وهذا شكله اللي يشبه الوجه مالت الإنسان، أو أكو ناس تقول يشبه وجه البومة، أو أكو ناس تشبهه بنصف العرموطة كمثرة مقسومة بالنص. مميز جدا بالتروفوزويت، وكذلك السيست مالته كبير اوفويد بيضاوي، الأربع أنوية مالته حجمها كبير، الأكزوستايل الفايبروز البقايا مالتها مبينة بيه، فتشخيصه غالبا يكون أسهل من البقية. ولكن لكون أكو طفيلي أيضا من الفلاجيليتس يصيب الأمعاء، مع أنه نادر مو مثل الجارديال أمبليا، ولكن قد يشتبه البعض به، فهذا معنى التحذير اللي بالdiagnosis. Regarding the treatment, giardiasis may be disappearing spontaneously. طبعا هاي في حالة كون الإصابة خفيفة مو إصابة شديدة. But usually is eradicated following therapy with quinacrine, which called also atabrine, or metronidazole. طبعا بالامتحان أنا قلت لكم أسأل إنه what is the drug of choice. هنا راح تكتبون لي quinacrine، مو تكتبوا لي metronidazole لكل البروتوزوا. هيك معناها أنتم مقارين، ما متأكدين من إجابتكم. Example number 2. Trichomonas vaginalis. The parasite has a cosmopolitan distribution, causes a disease called trichomoniasis or trichomonas vaginitis. التهاب المهبل الناتج عن الإصابة بالترايكوموناس. ميزوا هذا الاسم الثاني هنا. الفاجينايتس هذا مو اسم علمي، هذا معناه التهاب المهبل الناتج عن الترايكوموناس. الاسم اللي قبله هذا هو اسم علمي للطفيل المسبب. This species is found only in a trophozoite stage, which means we don't have cyst stage in this parasite. The parasite has a large nucleus and 4 anterior flagella of equal length. A fifth one lies on the margin of a relatively short undulating membrane. الأندوليتنج ممبرين يسموه الغشاء المتموج، هو عبارة عن فطية جلدية تشبه الزعانف الموجودة بالأسماك. مجرد شبه تشبيه، هي يعني تشريحيا وتركيبيا ما تشبهها، بس حتى تتذكروها. Which does not extend beyond the posterior margin of the membrane. طبعا نقصد هنا الفلاجellum. There is also a delicate exostyle protruding for a considerable distance beyond the posterior tip of the organism. The multiplication by longitudinal binary fission. Look for these 3 pictures for the trophozoite stage of Trichomonas vaginalis. الوحدة اللي جوا كلش حجمها كبير، طبعا هو مو هيك حجمه، هذه magnified under the microscope، مكبرين حجمها حتى تشوفون الديتيلز والفلاجيلا مالتها واضحة. الصورة الفوق مؤشر على الأجزاء، أيضا تقدرون منها تميزون الأجزاء اللي دا نحكي عنها. Its habitat is the human vagina in females and the genital tract in males, and probably localized in the prostatic gland and the urethra. يصيب الذكور والإناث. هو mainly يصيب الإناث، لكن عن طريق الاتصال الجنسي ممكن أن ينتقل إلى الذكور أيضا. Mostly non-pathogenic for male, but sometimes causes urethritis. Transmission of the infection is principally through sexual intercourse or by the mucus of the infected person in the WCs or underwear. Damp washcloths and similar items also are sources of infection among children and adults. Symptoms. The infection in women is frequently symptomatic. تصاحبها أعراض مرضية. The symptoms vary from mild to severe, while about 15% of women with trichomoniasis complain of symptoms. Altered vaginal secretions are evident in many more. Vaginitis with a purulent discharge is the prominent symptom and can be accompanied by vulvar and cervical lesions, abdominal pain, dysuria and dyspareunia. It also leads to heavy acidic mucoid secretion. Excessive discharge together with genital sprays may produce urticaria and acute vulvitis. The incubation period is 5 to 28 days. In men, the infection is frequently asymptomatic. الرجل ما تظهر عليه الأعراض المرضية بشكل واضح. Symptoms are much less noticeable, although occasionally urethritis, epididymitis, prostatitis can occur and swelling of the prostate gland. For the diagnosis of a trichomonas infection, microscopic examination is necessary to examine the wet mounts, which may establish the diagnosis by detecting the actively motile trophozoites. For the diagnosis of male infections, gives stained smears of urethral and prostatic discharge are useful, whereas vaginal and urethral discharge in the females are the useful samples. Examination of the urine of both sexes and examination of prostate secretions of the male following a prostate massage are also helpful diagnostic procedures. In difficult cases, cultivation of a swab sample in Diamond's medium can be used, but the results are not available before 3 to 7 days. For the treatment of trichomoniasis, metronidazole is the most effective drug, although it's contraindicated in pregnant patients. Restoration of the normal pH of the vagina by periodic douches with a dilute solution of vinegar is an effective preventive method and can control mild infections. It's recommended that sexual partners be treated at the same time. The prescription can take the following manner: 1 metronidazole orally 3 times for 7 days والدوز عندكم موجود. Vaginal insert subsidiaries of metronidazole daily concurrently with the oral regimen provide increased efficacy in resistant infection. There are 2 other species related to genus Trichomonas. The first one, Trichomonas tenax. This flagellate is commonly found in the tartar and gums of the mouth, as well as in the nasopharyngeal region. Transmission is necessarily by direct contact, usually kissing or using contaminated eating tools. The organism is non-pathogenic and can be avoided through a proper oral hygiene. Like Entamoeba gingivalis, it tends to flourish in unhealthy environment. Its presence associated with gum diseases. The second example, Trichomonas hominis. This organism is smaller than Trichomonas vaginalis. It is generally considered a non-pathogen of the human colon, and while it is often associated with diarrhea, there is no definite evidence that it causes the condition. The ability of trophozoites to survive for at least 24 hours in feces-contaminated milk suggests that transmission may occur through contaminated food and drink, and that trophozoites are able to withstand the acidic environment of the stomach en route to the intestine. This is a picture for Trichomonas tenax. Now we'll talk about the third group of protozoa, ciliates. They constitute a group related to subphylum Celiophora. They are characterized by having numerous cilia in at least one stage of their life cycle. The only ciliate that is a parasite of man is Balantidium coli. This parasite has a cosmopolitan distribution and infects the hogs several species of monkeys as well as man. This parasite mostly found in warm climates and tropical regions. It has 2 stages, trophozoite and cyst. The trophozoite lives in the lumen of the cecum and colon, feeding on the host cells, bacteria, food substances in the tissue or the intestine contents. The trophozoite is the largest protozoan parasite that parasitizes man. It's ovoid, covered with short cilia that are constantly in motion during life. The anterior end is somewhat conical and the posterior end is broadly rounded. It has 1 and sometimes 2 large, slowly pulsing contractile vacuoles lie in the cytoplasm. The presence of contractile vacuoles, unique among parasitic protozoa, indicates a degree of osmoregulatory capability. There are also many food vacuoles in the endoplasm. Food vacuoles contain debris, bacteria, starch granules, erythrocytes, and fragments of host epithelium. من هذا الوصف نقدر نخمن أنه الطفيلي pathogenic لأنه يتغذى حتى على خلايانا. The movement of cilia and enzyme secretion help the parasite to penetrate the mucosa. The parasite is pathogenic. It invades the mucosa, submucosa of the large intestine. Its movement causes a rapid destruction of the tissues. It's unlike Entamoeba histolytica because it doesn't invade the muscular coats. Multiplication is by binary fission. Here is a collection of pictures to the trophozoite stage of Balantidium coli. طبعا هو مو هذا حجمه، هذا أيضا magnified under the microscope. شوفوا الصورتين الملونة، هذه stained، بينما الصورة الأخيرة treated only with a drop of iodine. شوف السيليا شلون مبينة بيها، اللارج نيوكليوس مبينة، الصورة الأولى الكبيرة الحجم المايكرو نيوكليوس النواة الصغيرة أيضا مبينة بيها. And these two pictures also for the trophozoite stage but in sections within the intestine. Look at the parasite. Transmission of Balantidium coli from one host to another is accomplished via the cyst. يعني الcyst هو الانفكتيف stage. The cyst is round, the cilia, large macronucleus and contractile vacuoles are readily visible within the cyst. Incystation usually occurs in the large intestine but may also occur outside the body of the host. The cyst discharges with the stool of the human and hogs. Infection occurs when cysts are ingested by the host. Excistation occurs in the small intestine. These are two pictures for the cyst stage of Balantidium coli. To the left, unstained sample. The macronucleus النواة الكبيرة can be detected مبينة واضحة إضافة إلى cyst wall. شوفوا شلون سميك. To the right, this is a fixed and stained cyst or sample بعد أكثر وضوح الأجزاء مالته. Pathology and symptoms. The trophozoite resides يعني يسكن أو يستقر in the cecal area and throughout the large intestine. It flourishes in an environment rich in starch such as the small intestine. However, in such an environment the trophozoite does not invade the intestinal mucosa. This tendency for carbohydrate may be the reason for the trophozoite's invasive character once it becomes established in the human cecal region, a region low in carbohydrate content. يعني طول ما اكو carbohydrates واكو starch هو ما يهاجم جدار الامعاء ويبقى يتغذى بشكل طبيعي ويسوي الكولوني مالته باللومن. مجرد انه يقل تركيز او محتوى الامعاء من الكربوهيدرات ومن الستارش خصوصا راح يبدي يهاجم الميوكوسا مالت الانتستين بواسطة البروتيولايتيك انزيمز مالته. It's believed that the trophozoite secretes proteolytic enzymes that act upon the mucosal epithelium, facilitating the invasion. The symptoms vary from acute to asymptomatic carrier state. Parasitic invasion of the mucosal epithelium is followed by hemorrhage and ulceration. Hence the name balantidial dysentery, often given to this condition. While symptoms such as colitis and diarrhea may resemble amoebiasis in many respects, extraintestinal disease is rare. يعني هنا بالرغم من أنه الطفيلي دا يغزو جدار الأمعاء، لكن دا يوصل فقط إلى الميوكوسا والسبميوكوسا، ما يخترقها ويوصل للبلاد كابيلاريز وينتشر مثل الأميبا إلى أجزاء خارج الأمعاء. The symptoms are presented by fulminating dysentery or acute diarrhea. Dysenteric feces consist of mucus, blood, pus. The diarrhea 6 to 15 times daily. The chronic infection causes general weakness, chronic diarrhea, nausea, abdominal pain, and anemia. The diagnosis of the infection with this parasite, the usual diagnostic procedure consists of a stool examination for the presence of trophozoites and cysts. Cysts can be identified by their large size, heavy cyst wall, large macronucleus, and the presence of cilia within the cyst, whereas the trophozoites are readily identified by their large size and the fact that Balantidium coli is the only celioforan parasite in humans. For the treatment, drug treatment usually consists of oral administration of diiodohydroxyquine and tetracycline drugs, or metronidazole or iodoquinol. Now we reach to group B of the flagellates, the blood and tissue flagellates. This group of flagellates, also known as hemoflagellates, they require two hosts in their life cycle, man or another susceptible mammal on the one hand and a blood-feeding insect act as a vector on the other hand. They are belonging to two genera, Leishmania and Trypanosoma. During the life cycle of these flagellates, they may appear in four distinct morphological forms distributed between the vertebrate host, the final host, and the arthropod host, which is the intermediate host. It appears that any of the forms is capable of developing into any other. These forms are different in their morphology, flagellum position, and if it is present or not, the shape of the kinetoplast المولد مات الحركة, and its position and the presence or absence of the undulating membrane. These forms are summarized in the following. 1. Promastygote. This form occurs only in the insect vector. The body is a spindle in shape. The nucleus in the middle of the body relatively. The kinetoplast nearby the anterior end. The flagellum extends from this structure and become free anteriorly and extend outside the body. There is no undulating membrane. Its long flagellum is serving the function of both locomotion through the medium and the attachment to the insect gut wall. 2. Epimastygote. The body is a spindle in shape. The kinetoplast in front of the nucleus, which is found nearby the middle of the body. The flagellum grows and extends till the anterior end, attached to the pellicle, producing an undulating membrane, then extends freely. 3. Trypomastygote. The body is a spindle in shape. The nucleus in the middle of the body. The kinetoplast in the posterior region of the body. It produces the flagellum, which extends on the out margin of the undulating membrane, then extends freely. 4. Amastygote. The body is spherical or ovoid with oval nucleus found nearby the body center. In front of the nucleus, the kinetoplast is laid, which produce a short flagellum extends till the body surface, and there is no undulating membrane in this form. This form usually develops in vertebrate host cells. Genus Leishmania. Through the use of molecular and immunological techniques, a number of species and subspecies of Leishmania have been partially characterized. Of those that infect humans, three clinical manifestations are evident: visceral, cutaneous, and mucocutaneous leishmaniasis. While their life cycle are identical and they are morphologically indistinguishable, they differ in the type and location of the primary lesions they produce in the human host. Leishmaniasis are now endemic in 88 countries of 5 continents, with a total of 350 million people at risk. The vertebrate host of the parasite is the mammals, particularly the human, dogs, and many species of rodents, whereas the invertebrate host, the vector, is the sandfly. Life cycle. For all species of Leishmania, the part of the life cycle spent in mammalian hosts is unbelievable in that the amastygote infects the macrophage, the cells of the mammalian host that constitute its primary defense against invasion by foreign organisms. The parasite, upon entering the macrophage, establishes itself in an endocytotic vacuole called a parasitophorous vacuole. A number of mammals act as natural reservoir hosts for the parasite, the most common being canines, both wild and domestic, and rodents. Leishmaniasis in humans is therefore a zoonosis من الأمراض المشتركة بين الإنسان والحيوان. In the vertebrate host اللي هو إحنا, when the sandfly, الفيكتور, ذبابة الرمل, takes a blood meal from man and other mammals while they are carrying the infective stage of Leishmania, which called the metacyclic promastygote, it will passively inject these parasites, which will be quickly engulfed by the host macrophages in the reticuloendothelial system, where the promastygotes revert to the intracellular amastygote form. After sequence longitudinal binary fissions, the cells are filled with the parasites and rupture to release large number of the amastygotes, which are engulfed by other phagocytic cells, thus spreading the infection. At times, many infected phagocytic cells arrive to circulation and to viscera, where the parasite will settle down and multiply in the reticuloendothelial cells of the liver, spleen, and bone marrow, causing the destruction of these cells. The invertebrate host, يعني الحشرة, are many species of sandfly from genus Phlebotomus. When the insect bites the infected vertebrate host, it will suck the blood and the amastygote stage of the parasite, which migrate to the midgut of the insect and transform to promastygote form and start in multiplication by binary fission. After 4 to 5 days from the insect feeding, while attached to the wall of the gut, the promastygotes multiply rapidly by longitudinal binary fission and fill the esophagus. The promastygotes, as they transform to infective metacyclic promastygotes, detach from the gut wall. When they block the esophagus, the insect will push the esophagus content to the front and back. By this method, the insect will inject the infective stages in the victim, which are subsequently deposited in the skin of the mammal when the sandfly feeds again. تلاحظون جوا هذه الصور تخص الفيكتور الساندفلاي. هذه الحشرة موجودة عندنا بشكل كبير، منتشرة في بغداد وباقي المحافظات، لونها ما بين بني غامق إلى رمادي أو أحيانا يكون لونها أشقر فاتح مثل هذا النموذج الأخير اللي على اليمين. The genus Leishmania includes the following species. 1. Leishmania donovani. This parasite causes a disease called kala-azar or dum-dum fever or visceral leishmaniasis or black fever. كل هذه الأسامي هي اسم لمرض واحد، أسامي مرادفة هاي. Its vector is the sandfly، ذبابة الرمل. هذا الcommon name sandfly. اسمها العلمي scientific name Phlebotomus papatasi. It causes the most severe and often fatal form of leishmaniasis. If left untreated, it has a mortality rate of almost 100%. In the mammalian host, mastigote-infected cells are found at numerous sites, example spleen, liver, bone marrow, lymph glands, and intestinal mucosa, as well as in the endothelial cells of the blood and lymph capillaries of the spleen, liver, and bone marrow. Sometimes the parasite infects the skin again and multiplies there. In this stage, the disease called dermal leishmaniasis or post-kala-azar. Symptoms and pathology. Since leishmaniasis is primarily a disease of the reticuloendothelial system, macrophage, replacement of infected cells produces hyperplasia and consequent enlargement of visceral organs associated with the system, such as the spleen and liver, causes splenomegaly and hepatomegaly. A concomitant decrease in red and white blood cells production results in anemia and leukopenia, facilitating secondary bacterial infection. Without medical treatment, the condition is usually fatal. Surviving individuals, however, commonly acquire long-lasting immunity. The incubation period varies from 10 days to many months, but in the usual case, it is insidious. On the average, about 90 days following exposure. The symptoms can be observed are 1. Greatly enlargement in the spleen and the liver with an increase in size and number of parasitized Kupffer cells. In the advanced cases, enlargement of the liver and spleen produces abdominal distension. 2. The bone marrow exhibits markedly increased production of macrophages and decreased erythropoietic function. 3. Thrombocytopenia results in multiple hemorrhages, particularly from the mucous membranes. While in the typical acute case, 1. Temperature fluctuates daily from 37.5 to 40 degrees. 2. Bleeding typically occurs from the gum, lips, nares, and intestinal mucosa. 3. Complications usually observed in kala-azar are principally diarrhea or dysentery and bronchopneumonia. Diagnosis. Definitive diagnosis based on the positive identification of intracellular mastigote in blood or tissue smears. When such smears are inconclusive, other diagnostic techniques must be employed, such as xenodiagnosis. Biopsy and punctures of such organs as the spleen and liver to reach the parasites are also useful diagnostic procedures. The parasite found inside the macrophages. Treatment. Chemotherapy consists of closely monitored intramuscular or intravenous injection of pentavalent antimonial compounds such as antimony sodium gluconate. The treatment should be given until the aspirate is free of the parasite for at least 2 weeks. 2. Leishmania tropica. This parasite causes a disease called dry or urban cutaneous leishmaniasis or oriental sore or Baghdad boil or Old World cutaneous leishmaniasis or tropicosaur. كل هذه أسامي مرادفة للمرض اللي تسببه هذه الليشمانيا. The vector is Phlebotomus papatasi and Phlebotomus sargenti. انتبهوا على الاسم العلمي، هنا عندنا 2 species تنقل، بس هي أيضا sandfly، ذبابة الرمل. Unlike the amastigote of Leishmania donovani, those of Leishmania tropica are found primarily in the macrophages around the cutaneous sores. Sandflies must feed at these sites in order to acquire the infective amastigotes. The tissue reaction is initiated with the introduction of the promastigotes into the dermis. The macrophage in the vicinity picks up the parasites which rapidly transform into amastigotes and multiply, destroying the host cells. Soon after, there will be a dense concentration of macrophages in the invaded area, all of which are liable to infection and destruction. The lesion then becomes necrotic at the center and the margins, containing parasitized macrophages, which may become infiltrated with giant and plasma cells. Pathology and symptoms. The lesion appears in the beginning as a macule, then as a papule, with a slightly raised center covered by a thin blister-like layer of epidermis. مثل حبة الشباب، أول شي شكلها حمراء مرتفعة من الوسط، شكلها مثل الحباية المتحسسة، الحافة مغطاية بغشاء رقيق لونه أبيض متكون من الابيدرمس on the skin at the feeding site of the insect. The papule become ulcerated after a few weeks, erupts with a discharge of a small amount of clear or purulent exudates and spreads, forming cutaneous lesions, most commonly on the hands, feet, legs, and face. In uncomplicated cases, there are no systemic manifestations. The common occurrence of phonic complications causes painful, disfiguring local ulcer, neutrophilic leukocytosis, and fever, and at times septicemia. In the absence of secondary bacterial contamination, sores tend to heal within a year, but disfiguring scars often remain. Look at these pictures on different sites on the body. Diagnosis. The uncomplicated lesion may be mistaken for a variety of infections of the skin. Hence, demonstration of the parasite is essential. Examination of Giemsa-stained slides of the relevant tissue is still the technique most commonly used to detect the parasite, as well as the serological methods. The most reliable diagnosis is achieved by in vitro culturing of lesion, scrapings, or aspirates, and subsequent identification of the promastigotes in the medium. هنا الوسط اسمه NNN أو 3N، وسط خاص لزراعة الليشمانيا. Antibody detection can prove useful in visceral leishmaniasis, but is of limited value where most patients do not develop a significant antibody response. Other diagnostic techniques exist that allow parasite detection and or species identification using biochemical isoenzymes, immunoassays, and molecular approaches which means the PCR test. Such techniques, however, are not readily available in general diagnostic laboratories. For the treatment of Leishmania tropica, the treatment of choice is a daily intramuscular injection of pentavalent antimony compounds for approximately 1 week. A second or third course of treatment may be required. Concomitant topical antibiotic treatment is employed in cases of microbial contamination of skin lesions. There is another type of this disease نقصد به الcutaneous. It's called mucocutaneous leishmaniasis or spondia in Brazil or many other tropical parts in America. The infection clinically resembles the oriental sore, but it's caused by Leishmania brasiliensis. The infection starts in the skin, but the sore spread to extent regions and appear in a big number of the mucous membranes of the mouth, nasopharynx, by extension or metastasis. It's also infecting the ear, nose, cartilages, and the throat, but not found in the blood, and in this is seldom in the inner viscera. The life cycle of this parasite similar to that of Leishmania tropica. With this slide, we reach to the end of our lecture today. Thank you for your listening. I hope you enjoyed the lecture and you find it useful for you. Thank you.